Now let's talk about whether you are a good candidate for liposuction, and we'll look at some before and after pictures to show you what kind of results that you could expect. So let's start off with this photograph here. This on the left, you have a patient with a very deflated looking abdomen, and you could tell her skin is not retracting well. It looks kind of like a deflated balloon. So it may have been because she lost some weight, or she may have had some childbirths, but her skin does not retract very well. So on a patient like this, I would not attempt to do liposuction because it's just going to make it look worse. The skin's going to look more deflated, and even though it'll be flatter, you're just going to have that loose skin hanging, and it's really not going to look good, and you're going to want to remove that skin anyway. So this patient I would send directly to a plastic surgeon to get a tummy tuck. And with a tummy tuck, what happens is they'll cut out a section of skin in the lower abdomen and then pull it together, pull it all the way down so the skin is nice and taut, and they can remove a lot of that loose, crepey skin and then create a new belly button. And this is really nice because you could get a nice, taut, flat belly. The disadvantage is that you're going to have a big scar, and it is a major surgery, and you're going to have a fake belly button. And even though in this patient it looks like she did get a nice shape in her waist, a lot of times it could look very boxy, make it look very straight. So a tummy tuck sometimes is necessary, and the only way that you can get a real tight stomach. But let's now look at some other cases where we can kind of go either way. Now, this patient here has a very large amount of fat. The before picture on the left shows significant fat in her abdomen, and it's almost kind of hanging over. And the skin quality is kind of borderline. She does have some stretch marks, but it's not like deflated looking. So she would be a good candidate for a tummy tuck. And if this patient is not opposed to surgery, I would probably say, why don't you just get a tummy tuck? But she didn't really want to have the surgery, didn't want to have the big scar. So this was a patient that I felt was worth doing liposuction on, but we had to do it in multiple stages. So in the first stage, we removed about half of the fat, kind of a debulking procedure, and then we wait 6 months to see how the skin responds. And if the skin retracts nicely and she doesn't have loose skin, then we can go ahead and do another stage. We remove the rest of the fat to get a much flatter abdomen. And here you can see, especially compared to the first picture, her abdomen is much flatter. It's not flat and taut, and there's a little bit of overhanging, but this is about as good as we can get it with someone who had that much fat to begin with. If we try to take more fat than this, we probably will have some loose skin. So this is what you can expect if you have a significant amount of fat like that. And she had a nice response because despite the amount of fat that we took out, she does not have a lot of skin hanging over. So she looks great in her clothes and in one-piece bikini. And she may even be able to get away with wearing a two-piece. This patient here is another patient with a large amount of fat, and the picture on the right is after the first stage. We did quite a bit of debulking, and you can see on the lower part of her belly there's a little bit of overhanging skin. So my inclination would be to just leave it alone now It looks much better than it was. If we attempt to take more fat out, she may or may not get a good skin retraction. We decided here to just leave it and not go for the second stage because we did not want to risk having loose, crepey skin, especially on the lower part of her abdomen. Now, if we did go for it and do another procedure and she ended up with loose skin, she can still get a tummy tuck, and you need to do a liposuction anyway, so it's not the end of the world if you end up with loose skin, but you just need to be aware of what the possibilities are, and sometimes you need to say, okay, this is good enough, and be happy with it, or just go for the tummy tuck right from the beginning. But again, she got a great result. Now, this patient is a great candidate for liposuction. Not terrible amount of fat. She does have a little fat. We removed most of the fat with one stage, with one procedure, and she's got a nice flat belly. She's got a tan in the after picture, and a belly button ring, but she looks great, and that was with one liposuction procedure. And this patient here is another good candidate. She had some previous surgery, so her belly button looks a little strange, and that's from the surgery, but her stomach looks nice and flat, and we could potentially go for a second stage and do some high-def liposuction on her. If that belly button really bothered her, then she could have potentially gotten a tummy tuck, and the new belly button may or may not look better than the old one. Sometimes after a tummy tuck, the belly button can look kind of fake, but this is a nice result. We can also do high definition liposuction, and this is one of my specialties. There are not everybody does high definition liposuction. I had to actually go to Colombia to learn how to do this, but you can take the fat off the muscle and just kind of create some etching around the muscle to give you nice definition, so you can get nice six-pack abs. So this patient, if you look carefully at the picture on the left, even though he's got a fat belly, he's got some muscle underneath it. It's actually poking through the fat. You can see a little bit of the muscle behind the fat. So he was a good candidate. And if we do this in 2 stages, we can really get some nice six-pack and definition with liposuction. Here's another patient who's got some muscle underneath, so we're able to give him more definition and expose the muscle beneath the fat. Now, this patient doesn't have a lot of fat at all on the left, the before picture, but he works out a lot, but he just couldn't get that fat off the lower part of the belly to make it flat. So that's when we can do a high definition liposuction, remove the rest of the fat and etch the muscles so that you can actually see the muscles showing through. And that's what we call our high def liposuction. Typically, the high def liposuction is done in 2 sessions, but with this patient, he got a great result with 1 session because he already had a great body to begin with, just a little bit of fat that needed to be removed. Here's another high definition young lady that does not have a lot of fat by any means, but she wanted a flat abdomen. And this is the type of patient, in the old days, I used to just, kick her out of the office and tell her, stop obsessing over her body because she looks great and there's nothing else that we can do. But the truth is, now with the technology that we have, we are able to give her that flat belly that she wants. So with a minimally invasive local anesthesia, we can we can do the liposuction safely. So it was worth doing. So this patient is another patient who's had some previous surgeries. So people with previous surgeries always tricky because it's kind of unpredictable how much scarring that they have underneath. So so in this case, we would use the Vaser liposuction, and the Vaser is an ultrasound device that can break through the fibrosis. And the picture on the right is immediately after the liposuction, and we got a great result. And she's going to continue to improve because this is immediately after. So over the next 6 months, she's going to get a great improvement in her body from the liposuction that we did. Here's a patient who has a little bit too much fat in the upper belly. We did the liposuction and we were able to reduce that fat and flatten her belly, but we did get some loose skin. Okay, so that loose skin tells us that we can't take any more fat from there, or that it's just going to look worse. So she looks great under her clothes. Her stomach's not bulging through, and this is what she wanted. I mean, she would have been happier if their skin wasn't wrinkled, but she didn't want to go through a tummy tuck. She just wanted to look good in her clothes, and she certainly does. So so as long as she knew ahead of time that this is the type of results that she can expect, given the amount of fat that she has, she got a great result from the liposuction. Here's a younger patient, and she had previous liposuction somewhere else. And unfortunately, it didn't come out quite the way she wanted to. It looked like they were trying to do some high-def lipo, but ended up giving her just unattractive lumps on her belly. Now, the good news is because she's young and her skin quality is good, I could really go after the remaining fat and just smooth everything out using our power-assisted Vaser and micro-air liposuction, and her skin responded nicely and retracted, and so she got a really nice result from a revision. And revisions are not always very easy to do because you can have some scar tissue that you have to go through. Here's another patient with multiple previous surgeries, and if you look at the picture on the right, it almost looks like she has a hernia. I mean, the picture on the left, the before picture, it looks like she's got a bulge there, but when I examined her, I could tell that it was actually fat and not intestines that were bulging out of her belly there. So we did the liposuction, and we were able to reduce that bulge because it was fat, and because she's had all these surgeries and scar tissues, we couldn't get her perfect, but she looks much better than she did. So she was happy. Here's another patient that didn't need liposuction, but she wanted a slimmer waistline, and she wanted her belly to be flat and taut. And for someone like her, we can do that with liposuction because her skin quality is really good and she doesn't have a lot of fat. And we can do that with one session of liposuction. Here's a patient after stage 1. We were able to remove a significant amount of fat and give her some definition. And then this is a patient where we could go in for a second stage and straighten out that belly button. We can remove more fat around the belly button and get it to kind of be more vertical instead of that sad belly button that she has right now. But that's going to require a second stage. Here's another high definition liposuction. And this is a selfie that a patient sent us. She was a great candidate for liposuction. She just needed a little bit. She had our 1 hour lipo. We were able to get rid of that little bit of fat that she had with a 1 hour procedure, and she sent us a selfie. She was so happy with the results. Here's another high definition lipo. This patient does not have a lot of fat at all, but she wanted her belly to be flat, and she wanted some of her ribs to show. So we can do that with local anesthesia and outpatient liposuction. We can treat other areas of the body, such as the arms. And when we're treating the arms, if you look at this picture, she's got quite a bit of fat. And we don't want to remove too much fat from the arms because you'll be left with loose skin. But if we did some liposuction with skin tightening, we can get a nice reduction. And it's really nice that we have the Renuvion skin tightening available, because in the old days this patient would not have been a candidate for liposuction. We would have had to do a brachioplasty, which would leave a big scar. A chin, we can do liposuction in the chin and neck area, and this patient had some fat in the chin submental area, and we did liposuction. Here's another patient that we did some liposuction in her chin. Now, if you see that on the after picture, she still has some fat left. And in this area, especially when you have that little bit of fat left, I would not go in again and do another liposuction, because we can just easily treat that with an injection. You can just inject some Kybella in there, then that should take care of that little bit of remaining fat. And here's another patient. We can go either way. We can do a liposuction, or we can do multiple injections of Kybella and get a nice result on the chin fat. We can do liposuction on the thighs, get rid of the saddlebags, and one thing to note is that liposuction doesn't really take care of cellulite. Sometimes we can make it a little smoother, but don't expect your cellulite to go away with liposuction, and sometimes it can actually make it worse. So those are the areas that we can treat with liposuction, or the typical areas that we can treat with liposuction. And next, we're going to talk about what we can do with the fat that we remove, because that fat is precious and we don't want to throw it out. So I'm going to talk in the next segment about fat transfers.